Hello students, welcome to All About Nursing channel. So today's video is going to about the positioning. So we all know as a nursing personnel, we have to know the different positions and in which condition we have to provide that particular position. So positioning of the patient is very essential for the care or for the improvement of the progress of the patient. So the patient who are has different patient has different complaint like respiratory problem. There is respiratory problem patient is there is patient who have gynecological problem, the patient who have cardiological problem. So there are different categories of patient are there, so we have to maintain the different position for different patient. So in this video we are going to learn the different position in which condition we have to give that particular position. Okay, so first position that we all know, that is supine position. Okay, so supine position is looks like that. The patient is in supine position. So patient is lying on her back. So in which condition we can use the supine position, like in patient in case of when we are going to do the physical examination or any medical procedures or any surgical dressing, anything, or any imaging or diagnostic procedure like CT scan, MRI, depending on the site of CT scan or MRI or X-ray, or like resting, the patient is on resting condition, where or in the emergency condition, different emergency condition, there the patient is placed on supine position, or post-operatively operatively on sometimes the pillow is taken off and the patient is kept on supine position. Okay, next position is the prone position. So prone position looks like that. The patient is lying on her chest. Okay. So in which condition we can give the prone position, like to improve the oxygenation, like in ARDS or any pneumonia. So ARD, in a patient who have ARDS, the prone position helps to remove the secretions, like it helps to improve VQ mismatch. So it reduces the VQ mismatch, it improves the VQ matching, that is one, and it helps for oxygenation. Okay, then helps in postural drainage of lung secretions. So prone, by maintaining prone position, it helps to drain out the secretions, and like reduces pressure on sacrum and heels, prevent pressure sores, to change the position in every 2 hourly or 4 hourly. So we can give the prone position, used in spinal surgery, or a patient who have any spinal surgery, spinal cord injury, if there is needed for prone position, so we can give the prone position. Laminectomy, spinal fusion, to do any spinal procedure, we can give prone position, mainly the spinal surgery. Okay, next, used in posterior cranial fossa surgery or certain rectal surgeries like pilonidal sinus surgery. So there we can give the for any rectal surgery we can give, in selective surgeries we can give the prone position, or it helps in facilitates the rectal examination and treatment. Next position is the Fowler's position. So it looks like that. The Fowler's position has two types, that is semi and high Fowler's position. Semi is the when the bed is about 30 to 45 degree angle, and high Fowler's is called when the bed is completely tilt, that is 90 degree angle. So that is called high Fowler's position. So when we give Fowler's position, for promote lung expansion, the patient who have respiratory distress or breathing difficulty, there we can give the Fowler's position. It helps in facilitates oxygenation and eases the breathing. It helps to improve the breathing. It helps in cardiac it patients for decrease in the patient who have decrease in venous return or cardiac workload, that patient we can give the Fowler's position to decrease the cardiac workload. Okay, and it is useful for feeding patients with swallowing difficulty, a patient who have NG tube, a patient is unconscious, there is NG tube, Ryle's tube. So in that patient we give Fowler's position, and after that we give the feeding. Then promotes drainage of gastric secretions, the patient who have gastric drainage is there. So in that patient we can give the Fowler's position, that helps to improve gastric drainage. Okay, and it also helps in comfortable position for postoperative patients, especially abdominal surgical surgery, or enhances comfort during tube feeding or NG tube, that I already told. Next is the knee chest position. By the time you can understand knee chest, the patient is lying on her knee and the chest. So it is used in patients who have rectal and lower intestinal examination, who needs rectal and lower intestinal examination, like sphygmoidoscopy or proctoscopy, or the patient who have rectal and anal surgeries like hemorrhoidectomy. So that patient, we can provide knee chest position. Or it also helps in breathing or oxygenation. It promotes rectal medication administration if we want to give any suppository or rectal medication through. So we can give this position, or enema administration, or the patient used for relieving the flatus and bowel distension. In that patient we can give, and helps in uterine prolapse repositioning. So patient who have uterine prolapse, that case we can give. Next, the position is lithotomy position. So lithotomy position looks like that. So here basically it is used in patient who needs gynecological examination. In during gynecological examination, you have to give the patient lithotomy position. During the spontaneous vaginal delivery, normal vaginal delivery, there we can give this position, lithotomy position. We have to give this position. Then any gynecological surgery like dilatation, curettage, evacuation, in that case we can give lithotomy position. Or any urological procedures like cystoscopy, okay, lithotripsy, or any prostate surgery, or any lithotripsy is basically to doing the to break down the stone from the kidney. Or so we where we can give this lithotomy position. Or any rectal and anal surgeries, like that I already told in previous, that is hemorrhoidectomy or fistula surgery. Or the patient who needs rectal examination like proctoscopy, sigmoidoscopy. Or patient who need, like female patient who needs catheterization, like if before surgery, before c-section. So there we can give the lithotomy position. Then perineal surgery like episiotomy, repair of perineal tear. For episiotomy, for giving episiotomy or for repairing episiotomy, where we have to give lithotomy position. For female catheterization, where we have to give the lithotomy position. In gynecological examination, we have to give the lithotomy position. Like in normal vaginal delivery, there also we have to give the lithotomy position.